Hi friends, I am Dr. Kleem from my YouTube channel Health with Dr. Kleem. Today I have to discuss the blowout fracture of the orbit. In the blowout fractures, what we see clinically is the sunken eye and what we see on the radiograph is a teardrop sign. Sunken eye on clinically, while we see on radiographs is teardrop sign. So first of all, I will discuss what are the blowout fractures and how we can say that this fracture is actually a blowout fracture. When we see if it is an orbit, the orbital floor is making the roof of the maxillary sinus. So what happens when there is an injury to the globe, direct injury to the globe, it creates pressure in the posterior portion of the orbit. And as a result of this, actually the floor of the orbit is a very thin bone. So what happens? That fractures out. And when this fractures out, the periorbital tissues, they move into the maxillary sinus. So this will be shown in the radiograph like occipitomental view as a teardrop sign. Teardrop sign is seen on the occipitomental view or Waters view. So whenever there is a fracturing out of the orbital floor, it is known as the blowout fracture. Okay, there is a consequence of this blowout fracture, and in this way we can say that the volume of the orbit increases. As a result, what happens? There are two movements which happen. First is the globe moves inferiorly. Secondly, moves posteriorly. So this results into anophthalmos. Sometimes it also results into hypoglobus, right? Anophthalmos and hypoglobus. These both terminologies are in used in case of blowout fractures. And whenever we say that there is an anophthalmos and hypoglobus due to the blowout fracture of the orbit, the treatment is aimed, we have to reconstruct the orbital floor. So when we have to reconstruct the orbital floor, we definitely have to go for either autogenous graft, or we have to go for allograft. So when we are talking of autogenous graft or allograft, so we have to consider one thing, and that is whenever we are there to discuss anophthalmos, the point of placement of graft is posterior to the equator of the globe. This will do the interiorly positioned globe and also correction of the anophthalmos. While in case of hypoglobus, we have to place the graft material just below the equator of globe. This is very important. If it is a globe, in case of anophthalmos, we have to place right here, the posterior way, while in case of hypoglobus, we have to place right here. So most of the time, the skull, skull and skull bone is utilized in autograph most of the time, which most of the time it has the less resolvability due to its cortical nature. The other thing is what we are using is the titanium mesh. So both of in your titanium mesh is actually a cantilever sort of graft, and that is fixed on the anteriorly on the rim. So now summary of the blowout fracture. Blowout fractures are mainly the fractures of the orbit, and when there is a movement of the bone outside of the orbit into the maxillary sinus, that results into the periorbital tissues movement into the maxillary sinus, and that results in the teardrop sign. And the two results we see, one is the anophthalmos and the other is the hypoglobus. And for the treatment of these both things, what we have to do, we have to go for the reconstruction of the orbital floor. And for the orbital floor reconstruction, what we have to do, we have to place the graft material right posteriorly in case of anophthalmos, while at the equator of the eye ball in the case of hypoglobus. So this is all about the blowout fractures, and what we can say clinically, sunken eye, and on the radiographic signs that the teardrop sign is well known everywhere. So thank you so much. Please subscribe my YouTube channel Health with Dr. Klee, so that my all videos come to you and you can get benefit of them. Thank you so much.